The first people to receive their COVID vaccinations in the Falkland Islands left the FIDF hall on Monday following the start of the Falkland Islands vaccination programme.
Yes, it went very well indeed. In fact, I was most impressed. I've had my jab, at least my first jab. I'm not exactly sure when the next one is, but they will let us know. But very well organised indeed. You go through in groups, and I was just lucky enough to have been in the first group going through. And a lot of paperwork involved, amazing amount of paperwork, but it all seems to be very well organised, and the jab itself, I didn't even feel it. They tell us that we may have a bit of a hangover tomorrow, but other than that, no, we are so lucky to have it here already.
Phase 1 of the vaccination programme started after the arrival of 3,000 doses of the Oxford AstraZeneca vaccine last week. Nearly 2,000 people are expected to be vaccinated during this first rollout, including all those under 50 or with underlying health conditions that have consented to have the jab.
So the people that we are vaccinating are the people that we think are most at risk of developing significant disease if they were to contract COVID-19. And so that's why it's really important to try and protect that proportion of the population, so that if we were to get COVID in our community, then absolutely we can be assured that we're less likely to have severe disease and illness, because obviously we're a relatively remote place. We have a very good hospital, but we don't have all the bells and whistles that some of the high-end ITUs in London, for example, might have. So trying to avoid people getting severe disease is really important.
There is expected to be another delivery of vaccine at the end of February, meaning that second doses can take place around 5 to 6 weeks after the first, in line with official guidance. It is hoped that the second phase of the programme can also start then, with key workers who come into direct contact with arrivals into the islands being prioritised.
We're also going to vaccinate a number of people who are in eligible occupations. So given that we've got no COVID directly in our community, often we've picked people who are, for example, meeting the planes, things like that. So people who might be coming from a country like the UK where there is quite a lot of COVID at the moment and risk bringing that into the Falkland Islands.
Travelling teams have also visited West Falkland and the outer islands throughout the week to ensure that as many people as possible can be injected. To date, the Falkland Islands have seen 53 cases of COVID-19, the majority of which have been picked up by quarantine surveillance swabbing. When it comes to COVID in the islands, the Falklands have been in a fortunate position, but it is hoped that this extra line of defence will help protect the community if an outbreak were to happen, as medical services here are limited.
I feel very fortunate to even live in the Falklands at the moment, because we're one of the safest places in the world for COVID, but also very fortunate to be one of the older people who people seem to think we're worth looking after.